Hello everyone, my name is Elizabeth and I will be here discussing my Ethics on Screen Medical Dilemmas in Grey's Anatomy, a case study of Season 2, Episode 27, Losing My Religion. So to start off the ethical dilemmas, to summarize, Dr. Stevens cuts the LVAD wires of a established patient and romantic partner, Denny Duquette Jr. The actions moved Denny higher up on the heart transplant list, resulting in him receiving a heart that would have gone to someone else. The core dilemma here is beneficence versus justice. Is this ethical to break rules to help someone you love, or should fairness and systematic integrity take precedence? So to identify the dilemma here, it is a right versus right conflict, so helping Denny survive versus following the transplant protocols. Stakeholders here involved, Denny Duquette Jr., who is the established patient and romantic partner of Dr. Izzy Stevens, who ultimately received a heart under the false pretenses and ultimately died of a stroke post-surgery. Dr. Izzy Stevens acted out on love and desperation for Denny Duquette Jr., but broke medical ethics in the process and quit the program towards the end of this episode as she realized she is not fit to be a doctor. Other transplantless patients were denied fair access to life-saving organs. The medical team and hospital system were both compromised and placed under investigation as the other interns were interrogated by Dr. Weber and were placed on the duty of creating a prom for one of the doctor's nieces as they were investigating who cut Denny's LVAD wire. So to explore both sides, side one consists of tampering with the LVAD wires, which is beneficence or love-driven care. This was based on love, care, and a desire to save Denny. This ultimately led to him receiving a transplant and proposing to Izzy. Side two, following protocol, justice, fairness to all patients, so maintaining that fairness, professionalism, and system integrity. This still would have left Denny on the transplant list with the possibility of death either way. So my position and justification here, I chose right number 2 to follow the rules. So this means upholding those ethical means, resisting emotional impulses that could create broader harm to patients, and violating the transplant process harm Denny and others. So by maintaining justice and fairness for all patients, shows justice and following the rules rather than just benefiting one. So by benefiting all rather than one. So ethical theory breakdown. So utilitarianism was not met. Harm was created more than help. So the outcome only benefited Denny and not other patients, and only benefited him temporarily at the expense of those other patients, as well as leading to poor Denny's death. Deontology was violated as the duties and rules were broken by Dr. Izzy Stevens. She broke the clear rules and duties that are inherited to medical professionals. Virtue ethics was somewhat shown here as compassion was shown, but she lacked more wisdom. So her loyalty and her love and her virtue was all there for Denny, but her lack of wisdom and prudence led to the tragic death of Denny. So core ethical principles here, autonomy. So Denny may not have fully been informed or consented to Dr. Stevens' plan. Beneficence. So the intention here was good, but Dr. Izzy Stevens poorly executes this. So Izzy intended to do good for Denny by cutting the LVAD wire, by moving him higher up on the list, but this created greater harm to Denny. Non-maleficence, so harm was caused as she violates the do no harm oath by contributing to Denny's death. Justice was also broken here as other patients were unfairly deprioritized. So Denny was only prioritized here more compared to the other patients as she manipulates these transplant lists to get him higher up by cutting the LVAD wire so he can get that heart faster that would have gone to a patient who needed it at that time. So this undermined the fairness of the transplant list. So ethical concepts, consequentialism versus non-consequentialism, harm outweighed the benefit regardless of intention. So the outcome here was Denny ends up dying of a stroke due to a blood clot. So the actions were not justified. These intentions do not excuse the unethical behavior on Dr. Izzy Stevens' behalf. Virtue and casuistry. So Izzy lacked that balance of virtue. There was no reference here to her past, and she and the other interns were at the hospital in the program. She showed compassion, but she lacked that balance of professional wisdom, so there is no real past here. So, to discuss relativism, personal values were clashed with professional duties as she acted on love and emotional impulses, but no professional ethics should be overridden. So, feminist ethics perspectives emphasizes the emotional reasoning and care. So, Izzy's actions aligned with feminist ethics by centering with emotional and caregiving, but emotional reasoning alone is not enough to ensure ethical care. Through the tragedy of Denny DeKett Jr. showed that ethics must be balanced with emotion as the duties of a physician. This highlighted the limits of emotional-driven actions in clinical settings and the importance of balancing care with professional boundaries. So a final reflection here is ethical dilemmas in media do show real-world complexities in healthcare. So Grey's Anatomy does dramatize the real ethical tensions in healthcare. This still shows the importance of grounding decisions in principle and not just emotions, as we see that compassion alone was not enough to save Denny DeKett Jr. So Grey's Anatomy shows the real ethical tensions in healthcare, but it is dramatized. Izzy's choices reflect the dangers of letting emotions override protocol, and ethical dilemmas are not always just black and white. Context here does matter. So, on an ending note, some questions I asked myself was, what kind of doctor do we want to become when emotions outweigh ethics? We can see this with Izzy realizing this and coming forward and admitting that, yes, she cut Danny's LVAD wire and that she is not fit to be a doctor, so she ends up quitting the program. So a question I asked myself here was, as future professionals, how do we balance care with consistency and love and justice? And I believe that this case study gives a good example of what happens when there is no balance between the two, or one is put more emphasis on the other. By having those two, the outcome may have been much more different for Denny either way, even if death was still a possibility for him in the end.